Across sessions of medical experts in the health sector have raised concern over the negative impact caused by the response against the novel coronavirus is having on the tuberculosis treatment and case finding in Nigeria. The stakeholders raised the concern on Monday during a virtual TB media roundtable with the theme Impact of COVID-19 on TB, Challenges and Opportunities for Service Delivery, Policy and Financing. Nigeria is said to be third behind only India and China in terms of tuberculosis cases, according to statistics. Every year, around 245,000 Nigerians die from tuberculosis.
All hands need to be on deck and incidentally, you see what we did when we deployed the wild track was to test for COVID-19, HIV, and tuberculosis simultaneously, because the Gene Expert machine, the Gene Expert 4, has 4 modules. So you can actually insert 4 cartridges and do 4 different tests at the same time.
Because we find out that the budget that we have been given to tuberculosis, we felt that it's not sufficient. Because we felt without the interventions of the donors, at least we could not be able to reach our target. And we felt that if at the end of the day, the donors are not there, what are we going to do? Therefore, we held meeting with the Speaker, the Honorable Minister for Health, and the Minister of Finance, of which we all agree that the capital of this 2021, at least we are going to do our best to see that additional 50% on the budget of tuberculosis is being implemented.
The medical experts are of the view that Nigeria needs the same kind of presidential task force on COVID-19 for effective fight against tuberculosis in the country.
There's a need to reassess the human resources for health, both at the federal level and at the state level, so that we are sure that diseases like tuberculosis and other health issues are not being placed on the back burner in our response to COVID.
So private sector plays a big role. I think COVID-19 has actually shown us that if private sector were interested, they can actually contribute a lot to some of the key health problems that we have. So talking about how we can engage the private sector. The private sector at the moment is already playing some roles. An example will be the ABAMI partners that are already contributing towards TB control, through building laboratories and treatment centers and things like that. So this can be expanded. So we need to identify more private sector partners to play a bigger role. They could do this through corporate social responsibilities, or even identify philanthropists, make them TB champions and give them awards and recognitions, high net individuals and people who can actually play a role.
According to experts, TB accounts for more than 10% of all deaths in Nigeria. Statistics also reveals that every hour, nearly 30 people die from the disease, despite effort being made to end the scourge. Basil Tokafo, Core TV News, Abuja.